Many people over 50 make one big mistake that actually makes their back pain worse while they think they're helping it. In this video, I'll share what that is so that you can avoid it and teach you what to do instead so that your back pain can actually get better. So what is the one mistake? Well, it's standing up tall. And that's very understandable. Since childhood, you were probably told, stand up tall, don't slouch. So when your back starts to hurt, it's natural to think that if poor posture is the cause, that you should stand up tall. When your back starts hurting worse and worse, you have the tendency to lean over and slouch. And then friends, children, or doctors may tell you, well, stop slouching, stand up taller. So again, you work harder at doing it. And that can become a vicious cycle. Now, it seems counterintuitive, but actually standing up tall is not good for your back, at least not the way that people do it. And as a physical therapist for 17 years, as well as a board-certified orthopedic physical therapy specialist, I've seen this happen over and over. But the real reason that you should stop standing up tall from your lower back is because it just makes sense. When you understand how the mechanics of your back work, when you stand up tall like this from your lower back, putting an arch in your lower back like people tell you to do, that jams the joints in the spine together. It also narrows the spaces where these little yellow nerve roots come out of the spine. And what that can do is create pain from the facet joints in your lower back. It can cause degenerative disc pain. It can cause spinal stenosis. All of the most common problems that older people experience can get worse from trying to arch their back and stand up tall with good posture. Conversely, when you lean forward, like many people do leaning over a grocery cart in the store, that gives you more spaces between the joints in your lower back. It also opens up the spaces where these nerve roots come out and takes pressure off of your spine. But what if you want to stand up with good posture? Well, there are ways to do that. You just need to do that from the correct places. So instead of standing up tall and arching at your lower back, you want to do it from your hips and your upper back. If you have tight hip flexors, it pulls you down into a position like this, and the only way that you can stand up tall is by counter curving at your lower back. So to stretch out your hip flexors, if you stagger your legs with one leg forward, one leg backwards, and then roll your pelvis like this, it stretches out the hip flexor of this hip that's going backwards. It also puts your spine in a better position where things are aligned more neutrally and you're not jamming the joints together like that. So roll the pelvis under, push the hips forward until you feel a stretch in the front of this leg, and then hold it for a minute, and then repeat that with the other leg going backwards. Roll the pelvis under, push the hips forward till you feel a stretch, and then hold that side for a minute. So that's the first exercise. The second one is for your upper back. If you spend a lot of time at a desk or on a phone or reading and get rounded shoulders in your upper back, again, that slouches you forwards. And if you want to look forwards, you need to extend at your lower back to make up for that. So if you can get rid of this rounded upper back, that eliminates the needs to hyperextend from your lower back. One great way to do that is standing up against the wall. You want to try to walk your feet a little bit away from the wall, press your lower back flat into the wall, and kind of do a little bit of a pelvic tilt like you did in the hip flexor stretch. Next, you're going to arch your chest up towards the wall, but don't force your head and shoulders to touch. In fact, it's pretty normal that they don't touch. So keep the lower back flat on the wall, arch your chest and shoulders up, and then bring your arms up like this. In addition to helping to get thoracic extension through the upper back, this also stretches out your chest muscles, which pull you down into this rounded shoulder position. So again, lower back flat on the wall, press your back up against the wall, slight pelvic tilt, and then bring your arms up like this, and then rotate back towards the wall. Again, you want to try to bring your hands back in that direction, but don't force your elbows to come back towards the wall. And then again, try to hold this position for about a minute. So those were 2 ways to avoid lower back pain if you're over 50. If you'd like more tips, you can check out this playlist over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you don't miss future videos to help you move better and feel better. Thanks for watching, and I'll see you in the next video.